Good evening, everyone. I'm Leah Cooper with your JCN News for this Friday, October 2nd. Health Minister Renward Wells speaking on the shortage of physicians, nurses, and other allied health professionals in the country. He adds that the COVID-19 pandemic has exacerbated the situation and the healthcare sector is close to seeing burnout within its staff complement, who he says have diligently fought this pandemic day in and day out from March of this year.
29 physicians, senior house officers are in the process of being hired. 20 will be deployed at the Princess Margaret Hospital, 4 in the Department of Public Health, 3 at the Sandlands Rehabilitation Center, and 2 in Freeport, Grand Bahama. We expect many will report for duty as soon as Monday.
Now, as for nurses, the health minister says this.
We were able to bring on board 2 nurses, and 3 more are in the process of being hired. An additional 4 have joined on a sessional basis. While these numbers may seem small, every additional person counts and provides relief, some relief, for their colleagues. We will continue to do more to increase our staff complement. The additional staff will strengthen our capacity to respond to this pandemic, while we support our healthcare systems and provide care to countless Bahamians and residents.
Minister Wells also renews the ministry's appeal to healthcare professionals willing and able to join in the battle against COVID-19. The Ministry of Health reporting 97 new cases of COVID-19, pushing the total number of cases in the country to 4,220. 77 of the 97 additional cases reported here on New Providence, 3 on Grand Bahama, 2 on Exuma, 1 on Andros, and 14 with locations pending. Today, there are 1,803 active cases. Hospitalized cases are at 93, 2,290 recovered cases, and 96 deaths. Health officials also confirming a non-COVID related death, which pushes the total in that category to 16. Deaths under investigation now stand at 15. 20,835 tests have been completed. The Public Hospitals Authority at Princess Margaret Hospital designates additional wards for the COVID-19 response. In a release issued this morning, the PHA says the private medical surgical 2W, and female surgical 1 were repurposed to facilitate COVID-19 patients on September 29th. Further, the PHA has taken steps to re-engage former interns as senior house officers and to proactively facilitate the return of nurses to clinical areas following their mandated period of quarantine in an effort to mitigate the existing shortfall in nursing coverage. With the implementation of these measures, the PHA says it will continue to monitor, assess, and manage the fluid response to the pandemic. Quarantine for individuals entering the Bahamas will no longer be required upon arrival to the country, but that new measure will not come into effect until November. The Ministry of Tourism announcing that the government will introduce new travel and testing protocols designed to eliminate the need to quarantine. Now, while the tourism sector is set to reopen on October 15th, until October 31st, incoming visitors must vacation in place for 14 days or the duration of their stay, whichever is shorter. In a Ministry of Tourism and Aviation statement last evening, it was announced, however, that beginning November 1st, the Bahamas will remove the mandatory vacation in place requirement for all visitors, returning citizens and residents, thereby enabling everyone to move about and explore the destination beyond the confines of their hotel or other accommodations. New protocols then would be that visitors, returning citizens, and residents will be required to obtain an RT-PCR test no more than 7 days prior to their travel. In addition, a rapid antigen test will be conducted upon their arrival and then again 4 days after arrival in the country. This, according to the statement, is to ensure that travelers remain COVID-free. Ministry of Tourism officials say the cost of the rapid test on and after arrival will be included in the cost of the Bahamas health travel visa. The ministry also noted that the rapid tests are easy, quick, and will yield results in 20 minutes or less, with results being provided electronically. Many hotel properties will provide relevant information on testing arrangements, while others will facilitate the required rapid tests for their guests. All persons on yachts and other pleasure craft will be able to make arrangements for their required rapid tests at the port of entry or via the relevant website. All other visitors, returning residents, and citizens will be able to make arrangements for their required rapid tests at the port of entry or via the relevant website. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.